Now we will discuss about gallbladder. First, we see the introduction. Gallbladder is pyriform in shape and sea green in color. Capacity of the gallbladder 30 to 50 ml capacity and lined by tall columnar epithelium. And what are the parts of the gallbladder? Three parts: fundus, body and neck. What are the functions of gallbladder? Functions of gallbladder: first is storage. It stores the bile. Second is concentration. Concentrate the bile 5 to 10 times. And third is acidification of bile. Now, composition of bile. 85 to 95% contain water and 5 to 10% cholesterol, bile salt and lecithin. If you see, bile duct connect with common hepatic duct by cystic duct, and here presents sphincter of Lutens and spiral valve of Hester. If anyhow a large stone is impacted in the cystic duct and CBD junction, causes distension of the gallbladder with mucus known as mucocili. Now we discuss about the gallstone. The most common type of the gallstone is cholesterol gallstone. Cholesterol gallstone, for the formation of the cholesterol gallstone require three mandatory factors. First is lithogenic bile, second nucleation and third is stasis. Lithogenic bile caused by supersaturation of the cholesterol, like obesity, our high cholesterol intake and coffee bread therapy, bile acid deficiency. Ileal resection as terminal ileum is involved in B12 reabsorption and enterohepatic circulation of bile salt. Ileal disease and bile acid sequestrant, cholecystramine and cholesterol. CYP7A1 gene mutation, lecithin deficiency, like MDR3 gene mutation. Second is nucleation. Promoting factor are infection and mucin glycoprotein. Third is stasis. Promoting factor are prolonged fasting, prolonged TPN are required, total parenteral nutrition, pregnancy, octreotide intake, OCP and massive burn. Second type of stone is pigmented gallstone. Pigmented gallstone, two types, black and brown. First is black. Insoluble bilirubin pigment, polymer of calcium phosphate and calcium carbonate. Property of the black pigmented gallstone: it is hard. See the black pigmented gallstone. Second, it is a radio opaque. What are the risk factors? Chronic hemolytic condition, hereditary spherocytosis, prosthetic heart valve and Gilbert syndrome. Second is brown pigmented gallstone. Brown pigmented gallstone most commonly occur in a common bile duct CBD, and it rarely occur in gallbladder. And most common in developing countries because increased risk of worm infestation like Ascariasis and Clonorchis sinensis. And what is the compositions of the brown pigmented gallstone? First is the calcium bicarbonate, calcium palmitate, calcium stearate. If we see the pathophysiology, so the dead worm trapped in the common bile duct or dead product in the common bile duct. A dead worm in common bile duct are infected by E. coli or Klebsiella, and it produces beta glucuronidase. These beta glucuronidase convert conjugated bilirubin into unconjugated bilirubin, and this form brown stone. See the brown stone.